You belong in the Sticker Club.
Hello, everyone, and welcome to the Sticker Club, sticking together for health equality. In today's episode, I'm going to talk about this presentation that I made on community health, artificial intelligence, and ethical responsibility for my philosophy class. Today, I will discuss how algorithms and generative AI are becoming more involved in healthcare and public health decisions, and why ethical oversight matters. Artificial intelligence is now used in hospitals, insurance systems, mental health apps, wearable devices, and even social media platforms that influence health information. These systems can improve healthcare efficiency and accessibility, but they can also create serious ethical problems involving privacy, bias, misinformation, and unequal treatment. My main argument is that society must create stronger ethical oversight for AI systems used in healthcare and community health because these technologies directly affect human well being, trust, and equality. During this presentation, I will explain 1. How AI is currently used in healthcare and community health, 2. Ethical benefits and risk of these technologies, 3. Why oversight and transparency is necessary, and 4. What responsibilities governments, companies, communities should have moving forward. So, to continue onward, to begin, it is important to understand what we mean by AI in community health. Artificial intelligence refers to a computer system that can analyze data, identify patterns, and make predictions or decisions in healthcare. AI is often trained using large amounts of medical information. For example, hospitals use algorithms to help detect diseases earlier through medical imaging. Apps and wearable devices track heart rates, sleep patterns, exercise, and mental health indicators. Public health agencies also use predictive models to track disease outbreaks, and identify communities that may need additional medical resources. Social media algorithms also play a role in community health because they determine which information people see online. During events such as COVID-19 pandemic, algorithms influence how quickly health information and misinformation spread. These technologies can create positive change by improving efficiency and helping doctors make better decisions. However, ethical concerns arise when AI systems become too powerful, too secretive, or too biased. AI can provide important benefits in community health. First, AI systems can improve the speed and accuracy of medical diagnoses. Some algorithms can analyze x rays, MRIs, and scans faster than humans, helping doctors identify diseases easier. This does not replace doctors. Second, AI tools can improve healthcare access. Telehealth services and AI chat boxes can help people in rural or underserved communities receive medical guidance when doctors are unavailable. Third, predictive analytics can help hospitals prepare for emergencies and allocate resources more effectively. Public health organizations can identify patterns in diseases, outbreaks, and respond more quickly. AI is also increasingly used in mental health support allocations. Some apps provide emotional support, crisis resources, and reminders for therapy and medication. These examples show that AI has the potential to strengthen community health systems and improve overall well being. However, ethical concerns emerge when these technologies are used without sufficient transparency, accountability, or fairness. Healthcare data is one of the most personal information people possess. Medical histories, mental health records, location tracking, and biometric information can reveal extremely sensitive details about someone's life. Many companies collect this data through apps, wearable devices, online searches, healthcare, and healthcare platforms. Sometimes users do not fully understand how much information is being collected or how it's being used. This creates ethical concerns about surveillance. Under what circumstances should companies or governments have access to personal health information? Even if data collection is intended to improve healthcare, there is always a risk of misuse. For example, insurance companies could potentially use health data to increase costs to certain individuals. Employers could misuse medical information in hiring decisions. Data breaches could expose your private records to hackers. If communities lose trust in healthcare systems because of privacy concerns, people may avoid seeking medical care or participating in public health programs. This is why ethical oversight and transparency are necessary. Another major ethical problem is algorithm bias. AI systems learn from historical data. If the data reflects social inequalities or discrimination, the algorithm may repeat or even strengthen those biases. For example, healthcare algorithms have historically underestimated the needs of the minority communities because the systems were trained using unequal healthcare spending patterns. If an algorithm incorrectly predicts who needs treatment, some patients may receive lower quality simply because of race, income, location, gender, disability, or other social determinants of health. This is especially dangerous in community health because vulnerable populations are often already underserved. Another problem is that many algorithms are not transparent. Companies sometimes treat their systems as private intellectual property, meaning the public cannot easily examine how decisions are made. When AI systems affect healthcare outcomes, transparency becomes ethically important. People deserve to know how decisions about their health are being made. Generative AI introduces another challenge: misinformation. AI can now generate realistic articles and videos and images. While these technologies have useful applications, it can also spread false medical information very quickly. For example, fake health advice or conspiracy theories can spread across social media platforms because algorithms prioritize content that receives attention and engagement. During public health crises, misinformation can create fear and confusion. People may stop trusting doctors, vaccines, or scientific research. Deepfake videos and AI generated misinformation can also make it harder for communities to distinguish reliable resources from false ones. The issue demonstrates that ethical responsibility does not belong to healthcare professionals. Technology companies also have the responsibility to reduce harmful misinformation and increase transparency about AI generated content. An important philosophical question is: who is responsible for ensuring AI is used ethically? I argue that responsibility should be shared. Pardon me, real quick. Sorry. Government should create regulations that protect privacy, prevent discrimination, and require transparency. Technology companies should design systems responsibly and test algorithms for bias before releasing them. Healthcare institutions should ensure that AI supports medical professionals rather than replacing the human judgment entirely. Developers and engineers also have ethical responsibilities because the choices they make during decisions can affect millions of people. Finally, communities and users should remain informed and critical about how technologies affect their health and personal data. Ethical oversight cannot rely on one group alone because AI impacts society as a whole. Responsibility must also be shared across society. So, what should society do moving forward? First, government should strengthen privacy protections for health data. Individuals should have more control over how their information is controlled and used. Second, AI systems used in healthcare should undergo independent ethical audits. These audits could test these algorithms for bias, discrimination, and accuracy. Third, companies should be required to provide greater transparency. Communities deserve explanations about how AI systems make important healthcare decisions. Fourth, education is important. Schools and communities should promote AI literacy so people can better understand how algorithms influence their lives. Finally, AI should support healthcare professionals rather than replacing human judgment. Human oversight is essential because healthcare decisions involve empathy, ethics, and the context that machines cannot fully understand. Some people argue that strict oversight and regulation could slow technological innovation. They believe companies need flexibility to develop new medical technologies quickly. This concern is understandable. AI has the potential to save lives and improve healthcare systems. However, ethical oversight does not necessarily prevent innovation. In fact, responsible regulation can increase public trust and encourage safer development. If people believe AI systems are unfair, invasive, or dangerous, they may reject technologies that could otherwise provide real benefit. Ethical standards help ensure that innovation serves communities rather than harming them. In conclusion, artificial intelligence is becoming deeply connected to community health. AI systems can improve medical care, increase efficiency, and expand healthcare access. However, these technologies also create ethical concerns involving privacy, bias, misinformation, and accountability. Because healthcare it directly affects human well-being, society must develop stronger ethical oversight for AI systems. Governments, technology companies, healthcare institutions, developers, and communities all share responsibility for ensuring these technologies are used ethically. Ultimately, technology should strengthen human well being and community trust rather than weaken them. Thank you for listening. Citations, citations. Canva hates hanging indents. More citations, citations. Canva still hates hanging indents.